get us started for those who can't join us live. Looks like we're recording. Good deal. So going back to the script here, we welcome each of you to the Building Strong Brains Collective Impact Virtual Workshop Series. Since its inception, Building Strong Brains Tennessee has connected brain science and communication science to change the culture in Tennessee to be informed by ACEs, trauma, and resilience. This culture change has prompted many professionals, communities, and philanthropists to use the latest brain science to better prevent and mitigate ACEs, trauma, and toxic stress. 4 years of comprehensive, coordinated, and collective work from both the private and public sectors have positioned Tennessee as a national leader in adverse childhood experiences response. With your leadership and collaboration, we hope this series will support communities to build safe, stable, nurturing environments that better prevent ACEs and build resilience. We want to thank the Tennessee Department of Health for co-hosting this series, and specifically my colleague Jen Trail, who's a co-host here. And we also want to thank Camelot for allowing us to use their online platform and for supporting us technologically through this process. We want to remind everybody that you are on mute and will be unable to unmute yourself. Please post questions in the chat box for the presenter's response at the end of the presentation. This webinar is being recorded and will be uploaded to the Tennessee Commission on Children and Youth YouTube page. Finally, please fill out the survey that pops up at the end of the webinar and let us know if you would be interested in joining a learning community addressing today's topic area. If you are interested in receiving notice of future professional development opportunities, please feel free to email me, Jen Drake Croft, at jenn.croft, CROFT, Now, I'd love to introduce our wonderful speaker, Melissa Oomer. Melissa brings 10 years of experience advising foundations, corporations, nonprofits, and collaboratives on many issues. Her interests are focused on collective impact, U.S. health, and community philanthropy. She has deep collective impact expertise, helping collaborative efforts work together in new ways to solve complex social problems. She helped establish an initiative in Dallas comprised of over 100 organizations working together to prevent and reduce childhood obesity. Melissa spent over a year in Douglas County, Nebraska, to start a collective impact effort for juvenile justice. Melissa also has experience advising foundations in New England on health-related issues ranging from the social determinants of health to the opioid crisis to healthy aging. Melissa spent a year working in India, where she led the development of a shared value strategy for a global pharmaceutical company's Indian affiliate to increase access to insulin among low-income diabetes patients. Melissa also brings a unique perspective to the community philanthropy focus area based on her previous experience working with community foundations through CF Insights. I also want to introduce some of our other featured speakers for today's event. We have Mark Cruz, who's Executive Director of Strong ACC, Paula Masters, Vice President for Health Programs at Ballot Health, and Kylan Hadley, ACE Nashville Coordinator. So now I'm going to go ahead and pass it off to our speaker. Take it away, Melissa.
Thanks, Jen. And I'll just thank everyone else for joining today while Jen gets the slides up. Thank you, especially to those of you who have rejoined us from our first session. This session, we're going to focus on 2 deeper dive topics. So our first session, for those of you who weren't with us and might want to access the webinar recording, was a general introduction to collective impact. And now for the next 3 sessions, we'll kind of go deeper on some topics that we got a lot of questions about. So today will be about systems change and the common agenda. And so we will just dive right in. I want to just thank you all for spending another 2 hours with us. I know it's a lot to ask in our Zoom-based world to take 2 hours out of your day. Just so you can get to know me beyond my professional bio, I am based out of the greater Boston area. I live here with 2 kids and a dog and my husband. And I've been doing this work for quite some time, and I'm really looking forward to learning from you all. So as you have questions or comments and things you want to share as we go through our materials today, feel free to do that. in the chat, as Jen suggested. So Jen, if you can just go to slide 3, I'll just briefly go over the agenda. So I'll spend a little bit of time introducing systems change and kind of the definitions that I use just to ground us all and have some common language. And then we'll spend a good 20 minutes on some breakouts. That's when you'll have a chance to work with some of your colleagues from across the state, introduce yourselves, and dig into some of the content. Then we'll have a short break and come back and speak about common agendas in detail. And we'll have some examples shared there. And we'll also have some time for some small group reflection at the end, depending on how many questions we get. And just so you know, if we run out of time, because we do have a lot of fun activities sprinkled throughout today's session, we will pick up wherever we leave off on the common agenda content in the next session on June 1st. So fear not, if there was more questions you had or things like that, we'll come back to the content. So if we can go to the next slide, just kind of a reminder of where we are in talking about how collective impact differs from other forms of collaboration. This is one of the main questions I get, is what makes collective impact different from a typical partnership or collaboration? And for those of you who were with us last time, we talked a lot about the differences in how the work is done. So we talked about how collective impact is cross-sector. It's not just one sector, but bringing together philanthropy and nonprofits and the public sector and the business community to get those different point of view on the table and kind of align around a common goal and the way to achieve that goal. The other kind of how that's different about collective impact is co-creation and community engagement. So really involving individuals who are affected by the social problem you're trying to solve, and make sure that this is not a process done behind closed doors, but is really engaging of the community. And then lastly, on the how side of things, there's really a commitment to continuous learning using data and adapting what you're doing based on what you see in the data, the discussions you have. And by data, I also mean, qualitative information that you might be gathering from the community as you're doing the work, changing things along the way. So we talked a lot about those hows. Today, what I want to focus more on is what the work of collective impact is. So we'll be talking about how it solves a complex problem at a population level. And to do that, you really need to use different types of strategies and programmatic strategies. We need to use systems change strategies. So these are things like policy change, shifting the way resources are allocated, changing mental models and mindsets and relationships. And I had a colleague who, early on in this work kept on saying, we don't need to start new programs, we need to work on systems change. And I actually had no idea what she was talking about. I said, can we just spend some time defining that? Because we, at the firm where I previously was working, FSG, we kind of threw that around and just assumed everybody knew what systems change was. And I found it really theoretical and abstract and a bit academic. And so I hope that today we can focus on what systems change is and demystify it a little bit through some examples. So I'll just set some common language and definitions, as I mentioned, and then we'll pivot into the examples. So on the next slide, for visual learners, just take a moment. Can you read this? Do you understand what this phrase is saying? And why I like to start with this is to show how our brains are really capable of taking individual components of information, in this case, kind of the letters that are here, even though they're scrambled, and interpreting them to make sense of a greater whole. So that's the whole sentence, obviously. We work really quickly when we're processing information, and we're able to put together a whole picture quickly based on some fragments of information. But oftentimes when we're doing social change work, we are really able to see the whole system, the way things are connected. We are positioned to see one part of the problem. We try to break things down to make them simpler and to make them more manageable and to kind of actually be able to work on one part of the problem. And in the work of collective impact, it's bringing together those cross-sector players to say, how do we put all of our perspectives together to really see the whole? And to me, that's always a really powerful moment in collective impact, when people can hear from each other and start to draw a visual of the system, for example, to better understand what is this entire system. Everyone is usually defining a system, whether it be the healthcare system or the juvenile justice system or the healthy aging system. The folks around the table all have a different definition. And for them, that definition is right and real. But for everyone working on the problem, kind of sharing those perspectives and understanding each other's perspective is really important. So just to define systems, since we'll be talking a lot about it. On the next slide, I have this system definition that I like to use. And just to read it out loud here, a group of interacting, interrelated, and interdependent components that form a whole. A system's overall purpose or goal is achieved through the actions and interactions of its components. And so why I like to pause on this definition is a lot of time we think about the system, of childcare or juvenile justice or whatever you all are working on, it's just the components. And what I want you to really focus on today as we're talking about systems changes, it's not just about the components, but the interactions and the relationships between the components. Because when we talk about systems change, a lot of times we're not changing the components, we're changing the way they relate to one another. And that's really important. The other thing I'll mention is when you're thinking about systems, I keep on talking about these really complex community-wide systems, but our bodies are systems, our families are systems, classrooms are a system. And so sometimes it can help to think about things on a smaller scale. But on this page, what you see here is a couple more definitions. So systems thinking is defined as the ability to see a system, to kind of look at how those parts interact. So over on the right-hand side, you see you're not supposed to understand the picture that's here whatsoever, but this is a systems map of the early childhood and education system for children 0 to 8, and kind of mapping this out as a visual to be able to do that systems thinking and understand what are the components and how are they related, and how are they not related? How are they connected or disconnected today? And then systems change is then saying, okay, after we're doing some of that systems thinking, what's the way that we want the systems to change? And so I really like this definition. It comes from Social Innovation Generation in Canada, where systems change is shifting the conditions that are holding a problem in place. And so when we're talking about systems change, we're saying, what are the conditions within this system, within our community, within our family that keeps on holding a problem in place? I'm sure many of you have heard people say, we need to change the system because we're not getting the outcome that we want to see. And a lot of people will say, well, you're getting the exact outcome that the system is designed to achieve. And so you need to change that system and shift the conditions of that system to get a different type of outcome. So there's a wonderful article by some of my colleagues who used to be at FSG, a social impact consulting firm, that started to say, okay, so what are those conditions? How do we define those a bit? So on the next slide, you'll see that they have identified 6 system change conditions that need to be changed. That if you want to say, we want to change the problem, change those conditions that are holding a problem in place, we need to shift 6 things. And in a moment, I'll define them. But I think what's really important here, and we're going to do an exercise to dive more deeply into this, is to think about these different 6 conditions, both externally to you as an individual or you as an organization, and also internally. A lot of systems change efforts mean thinking about how you contribute to the problem as an individual or an organization, as well as what you can do to change it and to change these conditions. And so that's really important to kind of take into this as a bit of humility about changing the system means changing things both externally and internally. And the other important thing to think about as we go into these is as you move from the top to the bottom of this inverted pyramid here, the top things are what we call structural changes. These are things that are more tangible and explicit. So this is changing policies, practices, resource flows. A lot of systems change efforts kind of start here. A lot of collective impact efforts start by identifying the policies, practices, and kind of funding limitations or gaps that hold a problem in place. And they're much more tangible to identify. Again, when you move to the middle layer, you have things that are a little less tangible, relationships and connections and power dynamics. So you can kind of name them, you can sense them, but they're not as explicit as that top row. And then at the very bottom, you have mental models or mindsets. And so those are really implicit. You don't know what people's mental models are, but you might have an idea of what are the mental models about things that are holding a problem in place. So just to define these a bit more on the next slide, starting at the top. So on the structural level for policies, we're really talking about government rules, regulations, and priorities that guide each other's actions. And then practices are very related to that. So I think about practices can be kind of like policies with a small p. So these can be organizational or agency policies or practices that result from an internal policy that reflect values and priorities. And then lastly, resource flows. So this is how money is allocated and prioritized towards things. So a lot of times when collective impact efforts start, you can start to identify, okay, there's a lot of these things that actually are generating outcomes we don't want to see. So how do we start to shift these? And I'll share an example in a moment about juvenile justice. The middle layer of relationships and connections and power dynamics. This is all about how those parts of a systems interact. And sometimes there's tangible things about policies or resource flows that then contribute to relationships and connections or power dynamics. But a lot of times it's just history. We talked last time about one of the readiness factors for doing collective impact is, do you have a history of collaboration and trust in the community? And so a lot of times you can get to this middle layer and realize that there's not trust, there's not strong relationships. And that's what's actually leading to there being gaps in service, because there's not handoffs, for example, because there aren't relationships, or there's power dynamics, that there's not referrals going in one direction or another. And then lastly, we have mental models. So here, these are at an individual level as well as at an organizational level. One that keeps on coming up here for some work that I'm doing on addiction right now is that individuals who are suffering from addiction, they're not valued in terms of their opinions about the matter or what's right for them in terms of treatment. And so that mental model of the healthcare or social service industry, if you will, not valuing what those individuals feel or want, means that the system's not as designed for them. And so identifying ways, how do you work on that mental model? The stigma of addiction is really one of the core drivers of trying to work on substance use disorder, for example. So we're going to have a little bit of, in a moment, we'll have some time to dig into these for you all. But I just want to share one example to try to bring this to life. So Jen mentioned in my bio that I spent about a year in Douglas County, Nebraska, which is where Omaha is, working on a juvenile justice collective impact effort. In here, they were really trying to look at, okay, we have increasing arrests year over year. What are ways that we can better understand what's contributing to that and try to ensure that less youth are ending up in the juvenile justice system? And so they did a lot of the mapping of the system, trying to understand it. No one could draw us a picture of the whole system. So we did a lot of that systems thinking work to better understand and define the system. And through some of that work, they said, okay, the kind of combination of the education system and the juvenile justice system, that's a source of where about half of the kids who were ending up in juvenile justice was because of things that were happening at school, either absenteeism or school-based arrests, or another problem that they said was school reentry. If a child had been taken out of school and was somewhere else coming back into school to have a positive experience. And so their effort was really to say, how do we get these systems together in a room, which was really tricky. It was a lot of different stakeholders to get them in the room and talk about, okay, let's take school-based arrests first. What is a way that we can start to reduce the number of kids who are getting arrested at school? What's a different way to approach this problem? There was a lot of different perspectives about it. It was a lot about those relationships that the school resource officers kept on saying, well, it's our job to follow through with discipline and arrest kids. And other people saying, well, how do we de-escalate more? How do we actually serve as a resource for these children? So they really started to try to understand each other's various perspectives and come up with a plan and a vision of, well, we all want these kids to succeed. We do all want to see them not get arrested. We want to see them be successful at school, be successful in life. And that's how they worked through several months of those conversations to identify a few ways they could do that together. So on the next slide, I'll just talk through the three core strategies that they did. So the first was they designed and implemented a pilot project called the School Justice Partnership. And here was really working, I would say, at all those levels of the 6 systems change conditions. So they created new practices and new policies that when there was a high-risk youth coming back after they had already been arrested once, they were coming back into school, and they wanted to just keep closer tabs on that kid and say, how do we make sure that we give them protective factors so they don't have a risk of rearrest, but they're actually very successful. So they changed the policies and the practices to say, let's meet the school resource officers, administrators, and probation officers who know about this youth to talk and come together on a regular basis, have that kind of practice to come together and actually work on the relationships and the communication. So that's that middle layer about relationships and communication, that all of these folks were working more in isolation before. They were all supporting a youth, but not in coordination. And so they came together to discuss those highest risk youth on a monthly basis and how to build those protective factors in a coordinated way, rather than kind of doing it on their own. The second piece that they did in conjunction with this was community-wide trainings for police officers. We found through discussions that, there was a commitment to training those school resource officers and other officers in the community who interacted with youth, but it wasn't kind of an ingrained policy or practice. And so they made sure that all the officers who were in schools and others could opt in, had training on teenage brain development and the consequences for discipline, as well as the legal consequences of juvenile justice involvement. So that was, policy and practice change at the top, that then really helped to change the mental models of these officers to think about the underlying causes of the youth behavior that they were seeing and how to react differently and to help the youth in a different way. And then lastly, there was a policy change from the Omaha Police Department to nationally certify all their school resource officers. This again was something that was done a lot in terms of making sure that the SROs were certified, but not in a way that was comprehensive or cohesive. And so they wanted to make sure that all of the officers were certified. And then kind of what came hand in hand there was the command staff really made sure that that training and that certification came with consistent messages about using more discretion and thinking about ways to de-escalate rather than go straight to arrests. And so that helped with kind of, again, the mental model flowing through from the top to the bottom, that inverted pyramid. So the great news was, after all of those changes, in the first 18 months, school-based arrests decreased by 50%. So it was something that didn't cost a lot of money in terms of the changes that they made, but really increased those relationships and the coordination and the communication and started to change mental models. So let me pause there. First, I wanted to just ask, before we go to the ACE Nashville example, to ask Jen Trail if you wanted to add anything about a similar example in Tennessee on juvenile justice, just to reiterate that this wasn't a unique circumstance to Omaha.
Yeah, thanks, Melissa. And yeah, there was a similar conversation happening in Nashville a couple of years ago, except it was about the alarming number of arrests of children under the age of 12 at their elementary school. And there was a really alarming picture painted of children who were having disruptive behaviors at school, and the school would call the police as a last resort. And then because handcuffs would not fit around their wrists, they would have to use zip ties instead to put them in the back of the car. So distressing conversation. There's a collective impact group here run out of the backbone is the Metro Public Health Department, called the Community Mental Health Systems Improvement Initiative. And because of the groups that they had convened and the organizations they had around the table, they had the school system, they had juvenile court, they had our mental health co-op, which is our crisis response, and the police department. And really initiating the conversation about this was juvenile court judge. And because they were all at the table, they had been having lots of conversations and working on those relationships. They were able to figure out a system that when it got to that crisis point of the school needs to call somebody for assistance, they would call the police, and they set up the system so that they would also call mental health co-op to come out and either assist the child with having a mental health crisis or to help de-escalate the situation. And over the next year, arrests decreased by about 75%. And I think the year after that conversation happened, which was in like 2019, there was only one arrest of an elementary school child, which was I think a dire situation. So it was all about the people at the table, and that they had formed those trusting relationships to change the system up and how they respond to those situations that had an impact to not re-traumatize those young kids. And
Thank you, Jen. Great additional example. So now I want to turn it over to Kylan. She is the coordinator of ACE Nashville. Mentioned at the beginning, ACE Nashville is working to prevent and mitigate the lifelong impact of childhood adversity to improve the safety, health, and prosperity of the community. And so she's going to share a bit about the types of systems change strategies that they've been using. And we'll pause for Q&A after she speaks. So feel free to share any questions that are coming up for you generally or specifically about the example as she's speaking in the chat, and we will address those for a few minutes before we go to the breakout groups. Go ahead.
Thank you, Melissa. It's good to be here with you all today. Yeah, thank you again. ACE Nashville stands for All Children Excel. Of course, it harkens to the body of science known as adverse childhood experiences and community environments. Just like Melissa mentioned, we are a public-private partnership focused on mitigating the impact of the lifelong impact of childhood adversity. And we specifically use a public health approach, which I think makes ACE Nashville unique in that way. Could you hit the space bar for me, Jen? We are grounded in CDC guidelines, which recommend safe, stable, nurturing environments as buffers to ACEs. We are grounded in other national initiatives focused on ACEs, and in the Community Health Improvement Plan, or the CHIP, in Davidson County in Nashville. And our work started with a consensus workshop with 44 Nashville leaders, all centered around asking the question, what strategies can we use to implement a comprehensive public health initiative which will prevent childhood adversity, promote family resilience, and improve lifelong health? Big question, but we wanted to bring people together because, again, like Melissa mentioned earlier in her presentation, co-creation is really important and unique to collective impact. And so we wanted to make sure this wasn't just another public health initiative. We didn't want a slogan or a public awareness campaign. We wanted a comprehensive approach. So today, ACE Nashville has, from those 44 leaders, we've grown into 480 plus individuals who represent over 170 organizations. So we've grown quite a bit since 2015 when we were formed. And a lot of that has to do with the principles of collective impact and the community engagement piece and co-creation and ownership. Can you hit that space bar again? So out of that 44 leaders, we came up with 4 priority areas, which have then become our work groups. These priority areas and work groups have their ownership over really unique and impactful systems change initiatives. Trauma-informed care, policy and advocacy, parent community education, and continuous quality improvement. They each have made incredible strides in changing the systems of Davidson County and Greater Nashville. I'll go into a little bit more in depth, but just kind of touch on what some of them are working on because it's all really important to the mission and vision of ACE Nashville. So the trauma-informed care work group actually just culminated a project that they had been working on for several years called the Roadmap to Resilience, or the R2R. It's a curriculum for organizations who are looking to become trauma-informed. And it is a multi-year curriculum. It requires a coach. There are retreats that you take. It's very in-depth because it's really about transformation, right? We want organizations, instead of just writing a trauma-informed statement and putting it on their website, we want them to ask themselves how to get to that mental model level of systems change and ask themselves, how can we transform what we do to be more trauma-informed? And that curriculum was developed through a grant by our work group, members of our work group, and then was recently just given, we partnered with the University of Tennessee College of Social Work to provide this curriculum across the state. And they are currently looking for sources of funding to be able to release this. So we're really excited about that. It's an incredible piece, when we talk about those mental models and in changing our policies and practice and systems. Our policy and advocacy work group does quite a lot of work when it comes to the structural changes. They're really always advocating for continued funding, for policy change, things that impact children and youth in Davidson County. Recently, they had an incredible win. The mayor's proposed budget that was released about a week ago has increased the funding for trauma-informed schools, which has been a key principle in our policy and advocacy agenda since almost the beginning of ACE Nashville. So that is really exciting work. Of course, the pandemic has raised the awareness, really globally, but in our community specifically, about the impact of trauma and how to support our children more proactively. Our parent and community education work group, they have done some incredible workshops. They do a monthly lunch and learn, and they are also, the individuals in that work group are some of the ones who set up our quarterly meetings, which is where we have everyone, all of the 480 members come together for learning opportunities. They have held some incredibly important conversations throughout the pandemic, particularly around healing racial trauma and what it looks like to build equity in our specific neighborhoods in Nashville. They reach regularly, for the one that I just mentioned, they had over 600 participants, and so they have quite a large audience and really working on those mental model pieces. And then our continuous quality improvement work group, they are doing incredible work in developing a system for data comparison, which will really kind of transform the way that our partners work together, where we see we're working well together as organizations and where we can build further bridges. And so if you can hit that space bar one more time. Like I mentioned, we are a collective impact initiative. And from the beginning, we knew we wanted to align very closely with Building Strong Brains to use their messaging, develop their frameworks, to continue to amplify and really dig into at the local level of what building awareness around positive and adverse childhood experiences and community environments would look like. Can you go to the next slide? So one of the things that we did early as ACE Nashville is we engaged the funding community. We knew that a public health approach would be different than what most folks were used to when they would think about a new program. We wanted to change those mental models early so that we could continue to build momentum without maybe some of those traditional expectations of what are you going to change in 1 year, right? We weren't wanting to change things 1 year. We were going for a culture shift. So we had to talk to the funders early. And in fact, we talked to them before we were even asking for money. We were asking for partnership. And we did a Building Strong Brains training that was very well received. It really kind of lit a fire with that group of funders. And then we told them, we have an ask for you. Now that you know about ACEs, you have a responsibility to join us in this work. We want your directors to be ACEs informed. We want your boards to be ACEs informed. And we want your RFPs to have questions about how will these projects, how will these programs work to prevent and mitigate the lifelong impact of childhood adversity. So as you can imagine, this had a ripple effect. Starting with the funders, it was very quickly disseminated to organizations across Nashville that ACEs and childhood trauma was incredibly important, and it would require all of us to answer at once. So suddenly organizations, in order to get continued funding, were having to orient their work towards asking about how are we preventing and mitigating trauma and childhood adversity. Since then, our funding community in Middle Tennessee has been some of our greatest allies in the work. They attend our quarterly meetings, they're even on our work groups, and they have asked, how can they fund specific projects that we're working on. And in fact, if you could go to the next slide, I'm going to talk about one that they have funded, which is, back one more, there you go. This is a flyer for an event that we held we screened a documentary called No Small Matter. And another one of our policy and advocacy strategic priorities is to increase access to high quality, affordable early childhood education. It is very easy to draw the connection of why early childhood education is important in preventing childhood adversity. When our children spend so much time with caregivers during the day, it is incredibly important that they are getting that serve and return interaction, that they're having really high quality care. And because this is a big chunk of their life in those early days, right? And so in Nashville, we are in trouble. We are in a childcare desert. In fact, downtown alone, I heard this figure a while ago, and it has like really always stuck with me. In the downtown Nashville area, there are only 139 slots for childcare and a need for at least 4,500. So we are severely lacking in high quality early childhood education. And we know that this is going to make transformational change if we can increase access in our city. One of the sectors that we wanted to expand into was the business sector. You can imagine that having businesses on your side who might offer childcare within their buildings or stipends for their employees, how that would be a transformational, partner in this work. But if we went to Amazon or some of these larger corporations that joined our work and said, you should care about babies, they'd be like, that's out of left field. What are you talking about? So we really had to work on what does it look like to expand our messaging, to talk specifically about why this impacts, Nashville's workforce. And we found this documentary, and it is an incredibly compelling portrait of what a lot of us in the childhood adversity and ACEs world understand already, but it demonstrates why investing in early childhood education can transform our economic well-being, can unlock the workforce, and really, make a more prosperous city. So we hosted this screening that was funded by the Bodecker Foundation and in partnership with Nashville Public Television, ACE Nashville, and the Child Care Alliance of Middle Tennessee. And we specifically invited business sector individuals to join us because we wanted them to see why this impacts you, why this is a good investment. And so it was a really great event. In fact, we're working on a follow-up event. We had a panel discussion afterwards. We had a parent, we had a person who runs a child care facility, and several child development experts to really discuss what this would look like and what the transformation would look like in our city, and why the childcare crisis is really holding us back. And specifically going into the business sector with this ask, we want you to join us on this project, was important because we are, still making these connections. We're inviting them to this table, but we're not asking them to come, just to listen to all the world's problems. We're saying, here's a project you can really make a difference in, and we're asking you to participate in this specific way. And so when we are able to gather in person again, the Bodecker Foundation has offered to host this in person, and we're really looking forward to engaging HR professionals and CEOs of these companies for a live panel discussion and screening of this documentary to really dig into what does co-creation and co-ownership of the solution of this problem look like, and how can the business sector and the human service sector partner in this way and transform our systems for change. And I think that's my last slide. We'll go to questions.
Thank you so much. That was just so wonderful to hear a rich example of how you engage the other sectors and you're really working to change the system. So we'll just pause for a moment to see what questions are coming up for folks that we can address before we go to our next section.
And feel free, for those of you who joined us late, to put your questions in the chat.
Kylan, I don't know if you're seeing this. There was a question about how suspicious were your business sector attendees of your ask for ACE Nashville?
That's such a good question. Well, we didn't do any cold asks, so we always ask for warm introductions from individuals. And in fact, I'm glad you asked this because one of our specific asks for the Donors Forum, the same Donors Forum that we originally spoke to at the conception of ACE Nashville, we just presented to them again 2 weeks ago. And one of our biggest asks was to help us use your connections. These are the leaders of the funding community in Middle Tennessee. We know you know the business sector. Talk to them. Who are the people who would be our allies? Who are the people who might already be primed to be interested and invested in this work? And so it was really based on that trusting relationship building. We weren't just calling the 1-800 numbers and asking for HR. We were really trying to make sure that we were harnessing the strength of our collective, which is in the vast web of relationships that exist.
And Kylan, can you explain where this fell in kind of the lifespan of ACE Nashville? Was this like earlier on, later on? Where was
this year? Yeah,
Okay.
It was actually during the pandemic, so it was really recent. And we did have a pre-screening that happened just before the pandemic, and then this event, the flyer that you just saw, was actually a virtual event because, of course, pandemic. And we are looking forward to having our follow-up. So this is ongoing work. I mean, we're still trying to build these relationships. We're still really wanting to set that foundation to shift that mental model within our partners within the business community.
Yep, that's great. I know just anecdotally, what I've heard from folks is that it's easier to get the business community on board once a collective impact initiative has had some success. There's something tangible you can point towards, even if it's just, hey, we've had this coalition, we've been meeting for this many years, we have this many people engaged, we have these funders on board, and even a few things you can point to about what you've achieved already can help bring the business community to the table because they see you have some momentum. So it can be trickier to engage business folks from the beginning if they don't see where they fit in to it. But once there's success and they can see their role, it's a bit easier. So interesting that it was kind of later, but it was recent. And so you've already had a lot of success. Yeah. And then there's another question about how to access the R2R curriculum.
That's a great question. It is not public yet, but we are really hoping we're going to be securing funding really soon so that we can launch this. We're probably going to be doing, well, I shouldn't say probably, our projected pilot launch date is fall 2021. And then hopefully we'll be able to release that information. And as soon as it's live, certainly we'll be getting with Jen Draycroft to disseminate that information to all of you.
Great. We have a comment from Marina Bogan. As we've been talking about changing the systems, wouldn't it be helpful to address ACEs by enrolling pregnant women in parenting classes by the time they are in their second term? As we know, people repeat learned behaviors. Seems to me that retraining has to be done with the parent of the child. So just a suggestion. I don't know, Marina, where if you can also put in the chat which organization you represent, it might be helpful for folks as context.
Yeah, if I could just speak to that really quickly. A two-generational approach is really important to the work of ACE Nashville. And while we are really focused on convening those direct practitioners, we have several organizations who do direct work with women who are pregnant and with their entire family units as well. So thank you for bringing that up.
And Marina was from the Shelby County Health Department. Thank you. And then another question. So we'll just wrap up with this one. And as you do have others, feel free to put them in the chat because we'll have another Q&A in about an hour as we wrap up. So if other things come up, just put them there in kind of a parking lot. We'll address them at the end of our session. But last question for you for right now. Does your organization work in other counties of Tennessee, or are you specifically within Nashville only?
We are specifically Nashville. However, we are partnered with Building Strong Brains Tennessee, and I know that Jen Draycroft could tell you a lot more about the statewide work.
Jen, do you want to take a minute to explain that? Or do you want to do that at the end?
You know what? Let me take just a second to explain it. So Building Strong Brains Tennessee, it's kind of like the statewide effort of ACE Nashville in some ways. We're a public-private partnership. We're looking to change the culture in Tennessee by educating folks on, early brain development, the impact of servant return interactions, ACEs, the impact of adverse childhood experiences and toxic stress, and how communities and individuals can build resilience through safe, stable, nurturing relationships and environments. So there's a lot that is under the auspices of Building Strong Brains Tennessee, everything from a massive training for trainers effort and public awareness campaigns to specific trauma-informed work and changes in state departments. So I will put in, instead of sucking up a lot more time here, I'll put in the chat a link that folks can use to access that.
Great, thank you so much. So just a last comment, just to make sure we cover it, that Rutherford County has started an outreach to the entire county called How Are the Children? Healthy Children and Healthy Families Equals Healthy Communities. So feel free to look that one up as well. Great, thanks for all the work you all are doing. So you'll have a chance now to talk with one another a bit and learn from one another. So if we can go to the next slide, Jen, I'll just introduce what we're going to be working on. So it's called an action learning exercise. So I'm going to put 2 links in the chat. The first is a Google Doc link to kind of the worksheet we'll be using if your organization, so that might just be easier to work in and download. If your organization doesn't allow you to download or work on Google Docs, I will put the original link here to FSG's website where this action learning exercise works. So feel free to access either one of those links. If you go to the next slide, Jen, I'll describe it a bit. So what we're going to do now is to have you all just do some reflection and take some action on how you can think about systems change related to the topic that you all are working on, likely something related to ACEs. And there's 3 parts in here. We're not going to be able to tackle them all, but we just want to have you start looking at this, discuss it with others, and have it as a takeaway to work on within your organizations or your coalitions or collaboratives, the different environments where you're doing this work. So the first part is really putting that inverted pyramid we talked about earlier this morning into practice to do an external assessment about what are the conditions in your community, however you're defining that community, that are holding your problem in place. So that's what we're really focused today. Part 2 is then doing that internal look, as I talked about earlier. What are the things that are going on with yourself or your organization that might be holding the problem in place? And then the last part is kind of putting it all together and thinking about what's next and how can you act on that information. So we'll just be focusing on part 1 today. So if you just go to the next slide, Jen. So we'll send you off into small groups in a moment. Please take some time to introduce yourself when you get into the small groups. And then we're going to have you just discuss how you responded to questions 1 through 4 in the action learning exercise. So if you get that downloaded, you'll see it's on pages 3 through 5. And so the steps you'll go through is to write the social problem or challenge that you're focused on at the top. You'll write your aspirational outcome. So if you already have a vision or a measure that you're working towards, you'll want to jot that down. So those are kind of your North Stars. And then to start to brainstorm, what are the conditions externally out in the community that are holding that problem in place? What's making you not be able to achieve that aspirational outcome? All right, excellent. Welcome back, everyone. Hope you enjoyed your dialogue with one another. Would love just to take 2 minutes to debrief in the chat. If you can just share any experiences you all had, either as individuals or in your breakout, about what happened to you as you went through this exercise. Were there any observations or patterns that stood out as you discussed this together? Was there a shift in your previous understanding of the problem or your approach? Just what came up for you. If you can share a few reflections in the chat, we'll read them out loud before we go to the next steps in a short break. Great, hearing from Connie, there was a focus on equity, diversity, and inclusion. That's helpful. Yeah, a lot of times we get to the mental models piece, and there's a lot of pieces there on equity, diversity, and inclusion. There's all mental models and mindsets are driving why we see disproportionate outcomes today. There's a lot of policies and practices and relationships as well, but it always shows up in that bottom layer. Marina saying, seems like communities have similar issues. Very true. So collective impact is an approach that's certainly not cookie cutter. It's very customized community to community, but there's a lot of similarities in terms of the challenges that communities face across the country. One group focused on recidivism rates and juvenile justice. It's great. And Jen is saying, Jen Trail, took some time to drill down on our issue. At first it was childcare access, but as we talked, it became more specific, lack of access due to behavioral problems. In other words, kids getting kicked out. Yep, so I really hope that this exercise can help you do a bit of that peeling back of the onion, of really talking about what are some of the root causes of the challenges, and what are ways you can address those. Connie also shared, sorry, these are moving on me. I'm reading the chat here. Transitioning our thinking about what we think families need and listening to and recognizing what they want. That's really great. You know, changing that mindset that the system or the practitioners, who are all really good people, know what's best, and to ask the folks in the community. Peggy says there's not enough people trained that can serve as champions. Kids need more self-worth, for sure. And the last comment here, keep them coming, but I'll just read this one and then transition to next steps. From Amy Little, I worked with justice-involved individuals with substance use disorders. Something that stuck out to me as I was doing the exercise was how mental models, assumptions, and stigma impact the other conditions, policy, funding, and practices, for sure. Yeah, all of these are very, very interconnected. So thanks for pointing that out, Amy. Great learning for folks to take away. So Jen, if we just go to the next slide, I'll just highlight some next steps you can take with this exercise. So once you've completed part 1 and part 2, either you can go through this on your own as a leader, you can bring it back to your organization or coalition that you work with. You should really have an assessment of the elements of the 6 conditions for systems change, and some ideas of how you might start to address those, as well as what your organization or agency can do to address it, as well as what you can do as an individual. So on the next slide, Jen, just to kind of wrap this up, here's some thoughts on what you could do next. Investigate and research the most important hypotheses you've developed. So things like, okay, we need to better understand what families or individuals in the community want. Bring that to folks and say, well, how can we do that? What are some steps that we can take? Who's been doing that successfully already in the community? How can we make that a more widespread practice? Map your findings from the exercise to the strategy you've developed. So if you already have a common agenda, which we'll be talking about next, understand where maybe this exercise brought up some new insights and how can you adapt your common agenda or your strategy to address those gaps. If you haven't yet developed a common agenda or strategy, this is a really good place to start. And then lastly, I'll just say, if you haven't already read the full article, this came from the Water of Systems Change. This might be helpful for you to take to your board, to your coalition, other leaders to really discuss. And I can, during the break, I'll put the link to that in the chat as well. So let's just take about a 3-minute stretch break, get some water, coffee, use the restroom, and we'll come back to wrap up in about 3 minutes at 48 past the hour. All right, I'm going to go ahead and just get started. Jen, if you don't mind going to the next section, just so we can end on time. So if you remember last time, we talked about the 5 elements that make collective impact different in terms of the how. If you go to the next slide, Jen, there are 5 things. The first is the common agenda, which we're going to discuss in more detail right now. So I'll skip over that. But just as a refresher, or for those of you who weren't able to make the last session, the other 4 elements were shared measurement, which is really defining your outcome that you hope to achieve through your work. The third is mutually reinforcing activities. For those of you who were with us last time, you remember that this is my least favorite phrase because it's super jargony, but it's really important. It means that each agency or organization that's participating in a coalition is doing something unique to contribute to the problem, to solving the problem. It's unique and mutually reinforcing what others are doing. So collective impact doesn't mean necessarily that everyone has to be doing the same thing. It means you do what's unique to your agency or organization to help contribute to solving the problem. Continuous communication is the fact that for folks to really work on systems change, to really dig down into that inverted pyramid that we've been discussing this morning, you need to have a lot of communication. You need to talk to develop those relationships and trust. You need to have a process that brings folks together. So that's why that's really, really important. And then last, we talked about backbone support. This is an individual or a set of staff members who wake up every day to just think about coordination and collaboration. That's what their job is. They don't have another full-time job. This is a dedicated resource. And this is what we found at FSG when we had a third-party evaluator look at what separates out really successful initiatives from less successful ones, the backbone staff member, as you all can imagine, as folks doing this work day in, day out, that really contributed to the success of having someone who wakes up and thinks about coordination and collaboration every day. We'll be talking about that role in more detail in our next session together. But for now, I'm going to just do a brief overview of the different components of a common agenda, and then invite one of our other guest speakers to talk about how they develop their common agenda. So on the next slide, just to kind of reiterate what I had said last time about the common agenda, this is really where you have this is your strategy it's your collective strategy for how you're going to do the work and what you're going to focus on. So the different pieces we'll be talking about is a goal statement, putting some boundaries on the problem you're going to solve. So knowing how far deep are you going into those root causes, what are the different boundaries in terms of geography or age or populations that you're focusing on, a set of principles that guide how you're going to work together. This is what makes us really different for some folks, is having a commitment for how you're going to work differently together. And then the systems change strategies, as you heard about ACE Nashville talking about the different work groups, the parts of the problem that they're going to tackle. And really what's important about the common agenda is not only what ends up on the page, but the process by which this is developed. So I'm going to iterate that over and over again as I go through these slides, that where you land is important in terms of what's on the slides or in the Word document or on the whiteboard, whatever you're using to document your common agenda is really important. But how you go about getting to that end point is very important. You want it to be participatory. You heard about ACE Nashville doing a lot of consensus building, and having people really align about what is this initiative about, or what is it not. Over and over, you'll come back to some things. I was working on a poverty initiative, and even at the very end, people were still saying, why are we not focusing on education again? And it was because there was another initiative focusing on K through 12 education. But that was a really important decision to say, what are you not going to focus on because others are already doing it in the community? What's going to make your coalition or collaboration really unique? A few myths, I've mentioned a lot of these, but that it's just product oriented. You can have a really glossy strategy or document that wasn't built through consensus sharing and building. That's not going to be successful. So it's not just about the end product. You don't want it developed top down with just kind of the usual players in the community. And it's not static and forever set in stone. So we, Jen and I have been talking a lot about this, is you just don't want to just make it be perfect so that it's never done. How do you get something down on paper that's good enough that you can start working with, experimenting with, get feedback about, and adapt as you go? So for the visual learners in the room, on the next slide, these are kind of five, the five elements of a common agenda that I touched on in the previous slide, but this might be easier for you to visualize. One is the principles, how are you going to work together? 2, problem definition. 3, goal. 4, the framework for change is kind of the working groups, or how the different parts of the problem you're going to focus on. And then plan for learning. This is all about the data you might collect to know if you're making progress. So we're going to just define these and share a brief example of each, and then hand it over to the Strong ACC to talk about their process of creating the common agenda. So on the next slide, the guiding principles are ways for the coalition to come together and say, what are the shared values we have of how we want to engage together? Some people call these the rules for engagement. They are typically built upon past experiences that individuals who are around the table have had of when collaboration has been done really well. And they're typically things that you could come back to in decision making to say, are we leaning into our principles in making this decision? Are we upholding our principles? Or there's something you can point to if a member of the coalition is not upholding the principles, to say, hey, we agreed to work together in this way. You'll see some examples here on the right about serving the whole community and making sure that you're focusing on systems change, taking an asset-based approach, everyone taking responsibility, empowering people and families, there's oftentimes a lot of various statements here of how you want diversity, equity, and inclusion to show up. The different viewpoints you're going to take. You're going to act in the name of and for the benefit of the whole of the community, not just your one agency or organization. So these are oftentimes things that you're trying to put out there to say, okay, I've seen collaborations fail because they didn't uphold these types of principles, or I know that when we've been successful in the past, here's the kind of hallmark features of it. So this is all about how the different folks around the table are working together. On the next slide, it's really important to also decide how you're going to define the problem. I'm sure many of you have had the experience of trying to set a goal and you just spin on what's in and what's out. How do you set boundaries on the geography or the population or the parts of the problem? So really looking at data, both secondary data, quantitative data in the community through community health data, et cetera, to better understand the problem. Disaggregating the data to look at which are the populations that have the most inequitable outcomes today, as well as looking at qualitative data, talking to folks. A lot of that quantitative data is going to be a look back. So you think about the last year that we had in COVID, that the data that maybe was from 2019 about kids' mental health is going to be really different if you gather that data today. So how do you rely on some qualitative data from the practitioners who are interacting with those youth, for example, to understand how the problem is changing and emerging in different ways? So making sure that that type of data is also equally as valuable as some of the more historical quantitative data. And this can also change over time. Obviously, that's another thing that the pandemic has taught us is, how we maybe defined the problem is going to be a moving target. So how do you continue to have those conversations? So if you click one more time, Jen, there's an example here of a diabetes initiative that kind of mapped out, who are we going to target? Are we going to take more of a prevention-oriented approach, which is what you see at the left, those that are at risk for diabetes, and those are diagnosed with prediabetes, or are we going to focus more on the right? What you'll see here, if you click again, is that they looked at the data, sorry, a few more clicks, and it's actually that the larger part of the population is on the left-hand side, the prevention side. And so this coalition said, there's actually the healthcare system is doing a good job focusing on the right-hand side of those who already have diabetes. We want to work upstream. We want to address some of the social determinants and other things going on that are growing the number of diabetics in our community. So they decided to say, we're only going to focus on the prevention side. So I think if you click one more time, you'll see how they kind of grade that out and worked on the left-hand side. So this is the type of conversation you can have by looking at the data and talking about what's going on and making some judgment calls about what's in and what's out. And then flowing from that on the next slide is when you set your goal. So if you have some of those boundaries set on the problem, how do you say, what's our goal? How will we know if we've been successful? And there's always a balance here of making it audacious and inspiring, as well as something that's measurable and practical at the same time, and making sure that equity shows up here. There's been a lot of folks calling out specific populations of BIPOC individuals in their goal statements as of late to make sure that it's not an afterthought, that it's front and center. There's one example here, if you click Jen one more time. This is the diabetes example that they, after looking at the problem on the previous page, their goal was to reduce the number of new cases of type 2 diabetes in 5 years, such that we have a 10% reduction in the prevalence of diabetes by 2030. And they have a specific emphasis underneath about low income and underserved populations. This was from a while back. They may even specifically today, given the evolution of these types of coalitions, start to call out the specific subpopulations by race and ethnicity that have inequitable outcomes today. On the next slide, we talk about the framework for change. So these are the different parts of the problem that you are going to work on, flowing from the problem definition and the goal statement. And really, I just look at this as saying, okay, if we have this goal statement, what are the things we need to focus on? And this is definitely, we'll talk more about this in our next session, but this is definitely a balance of art and science, because of course you could have 10 work groups, 10 parts of the problem you want to work on, but it's just not going to be feasible for you to convene 10 groups of a dozen people monthly over the course of a year. So there's a bit of prioritization that's going to have to happen here by just talking through the group and prioritizing based on need, where there's energy, et cetera. So there is an example here as well, Jen, if you click one more time. So these are the work groups that flowed from the diabetes example. So they were talking, their framework for change, if you will, was to use media to engage the community, to raise awareness, to increase screening and testing, to increase diabetes education and lifestyle change programs, and advance and integrate the medical system to better serve individuals. So those were kind of the 4 parts of the problem. And then they said, we also want to have a data task force that's continuing to look at the data and making sure that we're updating our approach based on what we're seeing in the data. And then lastly, on the next slide, the plan for learning. So shared measurement is we could spend hours just talking about shared measurement, but here what's really important is that your coalition is measuring both progress measures as you go about, how are you moving forward? How are you achieving the milestones that you said you would in terms of working together differently, as well as how do you know if you're making progress towards your ultimate outcome? So if you click one more time, Jen, there's an example here. The diabetes group was saying, okay, there was going to be specific working group level measures that aren't reflected here. But how do you increase a healthy community? How do you increase health behaviors, decrease risk factors, and ultimately decrease diabetes? So this is really trying to map measures against your theory of change to know if things are really headed in the right direction. And earlier on in the work, you'll obviously be measuring things more on the left-hand side of the theory of change. You're not going to see an immediate decrease in diabetes, but you may see an increase in healthy behaviors, for example. Okay, just a few closing thoughts here. Getting to common is hard. So I talked about the process that getting to a shared vision and shared understanding of the problem can be challenging because there's often siloed perspectives in a community. Everyone has their head down, they're doing amazing work. And it can be really hard to take the time and think about the big picture and then to get that consensus. There's oftentimes distrust that people, I've even heard there's competition, right? Competition across agencies and organizations trying to solve the same problem. And if things haven't gone well in the community, they're getting people to get to a common agenda can be really challenging. And then the last piece is misaligned incentives. So oftentimes there is that competition fueled by funders, for example. And so how do you move past that? This is not just about funding, but this is about aligning what everyone is doing and build that trust and see that the incentive is that everyone's job should be made a bit easier. So then I believe I have just one last slide maybe before I hand it off to Paula. Yes, so this just, I mentioned kind of the collaborative nature of gathering information to go into and building consensus to get to the common agenda. The community at large who will be benefiting from your work should also be engaged throughout the way. And this should not just be what is number one here. I think folks do a good job of understanding the current challenges by talking to the community and kind of doing focus groups to say, what are the challenges? How would you prioritize them? But the community should be engaged over time to co-create solutions, help with that prioritization. And if the direction that you're headed is the right one, expand the reach of strategies. So actually be involved in implementation. And then the last piece here is making sure that community members can help actually do that implementation, lead it, sustain the change, that this just, again, is not just top down. It needs to be also at the grassroots with the community really owning it and adapting it based on what their reality, what their lives are like. So just a kind of word of caution to make sure you just don't stop at number one, but you engage the community as you actually do the work and circle back to the common agenda. So next, I would like to invite Paula Masters from Ballad Health to talk a bit about the strong accountable care community. I had the great pleasure of working with this group back in 2019. They're doing incredible work, and we're all really lucky to get to hear about their common agenda process this morning. So she'll speak for about 10 or 15 minutes. We'll have a little bit of time for questions, and then we'll see if we have any time for breakout groups to discuss this content. If not, we'll pick up there next time. So Paula, over to you.
All right, thanks so much, Melissa, and good morning / afternoon, considering for our West Tennessee folks, it's still a little bit of the morning. So I'm very excited to be with you and be able to walk through a little bit of what we went through when we were really adopting the common agenda stage for our collective impact. That's the framework that we use for our accountable care community. So I'm going to be walking us through that process that we really implemented as we were trying to stand up this newfound ACC here in Northeast Tennessee and Southwest Virginia. Next slide, please. So just really, what is an ACC? I think a lot of times folks are a little confused by what an accountable care community really is. And there's an assumption that all accountable care communities use collective impact. And that's not actually true, is that our ACC decided to adopt the collective impact model because we really saw the utility in using that framework as we were really trying to have great impact as an accountable care community. Our accountable care community is quite unique in the fact that it spans 2 states. Usually accountable care communities are collaboratives that are really working inside of a single county or a region, but usually does not cross state lines. And so we're the only one in the United States that does cross state lines. And so knowing that we needed to tackle something that large is that we definitely wanted to use a best practice, and hence why we wanted to use collective impact. And so really an accountable care community, it really integrates, it takes that multi-sector approach. So just like Melissa was talking about, really getting the perspectives from all those folks that are involved, is that it allows for all of those multi-sectors to come in, and they're really emphasizing how it is everyone's shared responsibility to tackle something that large. That if you're looking for regional change or if you're looking for state change, is that you really have to bring in folks in a different way, and really looking at how do you start to have different conversations and move very much upstream when you're trying to tackle something like population health improvement. Next slide. So just really being able to lean in on Melissa's definitions and working through, those 5 pieces that she really teed up of how you create a common agenda. Our problem definition, if you want to go ahead to the next slide. Oh, thank you. Is that we really wanted to bring in folks and have a different conversation. Is that, social determinants of health is really sexy right now. But really what it means is very different. And so specific to different cultures and different regions and different populations. So what we did was we wanted to look at what the social, and I will also add on structural determinants of health into this one, what that really meant for our area. Healthcare is one of those things that is looking at social determinants in a certain way. And then when you think about your social service agencies or your education agencies, they look at social determinants in a different way. And so how do we actually have a common conversation to think about how we would even plan a common agenda around social determinants of health? So this is really where we started in our common agenda process, was being able to provide a little bit more comprehensive education together with all of our community partners around what it really meant for social determinants of health here in Southwest Virginia and Northeast Tennessee. If you'll go ahead to the next slide. And so this is one of my favorite graphics that was released around the same time that we were starting to really, wrap our arms around this. And it showed around when you're really thinking around social determinants and the difference between social needs, social determinants of health, and structural determinants of health, is that you've got to figure out where it really means in application or intervention design when you're thinking about moving upstream. And so when you're thinking around downstream, is that's really on that medical intervention side, that clinical care, that is that treatment side of things. So even if you're thinking around it from the educational side, it's really about addressing it because it's already been there. But if we're going to move very much upstream and we're going to be looking at true social and structural, is that is more around community conditions. That has policy implications. That has, I know that earlier in the session today, talking about systems change, that's where you really hone in and start to think about community impact and systems change. That's your most upstream metric. And the accountable care community wanted to focus its attention there. Next one, please. So what was our framework for change? Go ahead. So this is really how we started to tackle the common agenda. And I have to say is that when Melissa was talking about common agenda is hard, It is, but it is one of the most rich exercises that I've ever gone through with groups in my entire career. This was some of the best conversations that I have ever really heard around our region. And so it was just fantastic. And so we started in a way that we wanted to have, like I said, that different conversation. So really looking at different tactics around, community participatory research design and focus group, and how we might bring in others that were allowing for more inclusivity and some more cultural competence. And so one of the things that we adopted was really a multi-pronged approach to being able to bring in the data and show the data, but bring it into where we're not asking, again, what are the needs? And again, not asking the question of, what do you see in your community? It's more of, what have you seen, and how do you think that we should all work together on building out ways to solve it? And so we really looked at the World Cafe model and being able to do an amended version of that was a little bit more culturally competent. And so that's the process that we use. So we really started out by bringing in multi-sector stakeholders. This was back in, goodness gracious, October of 2018. And at that point, we were working with about 80 different organizations to bring in and host these regional focus groups that allowed for a comprehensive crosswalk, so that way everybody was seeing the same things at the same time, to be able to hear each other's perspectives of what they saw in those data, and then having that next round of conversation. And so through that process, and then we had follow-up strategic planning sessions the March following that then at that moment it was 150 different organizations, that there were 4 priority areas that everybody really wanted to focus on, that was going to be those pillars for our common agenda. And it was really, actually at that time it was 3. And so it was really around substance abuse and misuse, tobacco use, overweight and obesity. But then by using the framework of thinking around upstream, what do all of those things have in common? What did the data just tell us when we're looking at those social and structural determinants of health here in Southwest Virginia and Northeast Tennessee? And every one of those focus groups and every organization that was participating wanted to instead really focus in on childhood trauma and resiliency, thinking around ACEs and resilience and trauma-informed care. And so that's where our strategic focus for our common agenda really rolled up and took that as the priority focus area, knowing that if we could create impact there, then those other 3 that were listed would be able to be impacted as just part of the pathway to success. Next slide, please. So really moving into a different model. And so at that time, we were not called Strong. Strong was really born out of being able to best describe what our common agenda as an ACC really was. And so Strong stands for striving toward resilience and opportunity for the next generation. Really looking at, if we are going to impact, if our common agenda is to impact resiliency and childhood trauma, mitigate ACEs, is that we have to think through this as very much a life course model. And so that's really what is the model that you see in front of you. And so thinking around, how do we, that intersection of educational success and economic vitality and healthy lives, how do we go about that and involve all those folks? And so you can see here, it very much is a life course model that we really think about strong starts, so that conception to kindergarten age. Strong kids, looking at those things that are best and promising practice from kindergarten to 12 years old. Same thing around when we look at strong teens, moving into that, because there is very much differences in those 2 categories. And then strong families, knowing that there are things that we need to be working on with adults and caregivers that then sets up a strong start, that then sets up strong kids, and so on. And so you can see that it is very much cyclical. If you'll go ahead, please. And so I already hit on this, is that this is just really our regional resilience is our strategic focus as a whole. And then you can see how that life course model really rolls up into that when we're thinking about those populations, those, as Melissa was talking about, the dissection of those populations, knowing that each needs to have customized approaches that all roll up into your common agenda and your strategic focus. If you'll go on, please. And so what are our goals? How are we planning for learning? How are we going to track success? Next slide. So we, as an accountable care community, we came up with a 4-year strategic plan that had 18 different initiatives. And then each of those initiatives, it's not shown here. I'd be happy to share it, but I figured I would put folks to sleep if I shared each of these. But of these 18 initiatives, each initiative has a supporting logic model. So it has those process pieces and those inputs. It has those outputs of how we're going to track success. But then it also has outcome and impact metrics associated. And then all of those roll up into our data and evaluation framework for the entire accountable care community. So we're able to measure ourselves within initiative and then across initiatives. And so you can see that when we're thinking about doing things such as creating a system of coordinated care or a no wrong door, how if we're successful in meeting those impact metrics, that they have implications for things such as conducting regional asset mapping and being able to have a multi-pronged regional transportation solution. These are all interwoven together, and that was very strategic from our multi-sector groups. If you'll go ahead. And these are just other initiatives. If you'll go to the next slide. So here are our priority initiatives. So one of the things that I loved hearing Melissa talk about was how you need to have an iterative process for really parsing out initiatives and allowing for it to be fluid and be able to be responsive to what's going on. And so when COVID hit and the world changed, is that we very much knew that we needed to, number one, figure out what role we needed to play as an accountable care community, given what our communities were going through. And so we created an add-on COVID response and recovery plan to our strategic plan. And we implemented that, and it was sensational of what our organizations were able to accomplish. And and all of them together really spoke to that they wouldn't have been able to do all of those pieces if they wouldn't have been able to already lean in on the members, on their friends that were in the accountable care community. What it also allowed for us to do is to look inside of those 8 initiatives and really think through, what should we be doing right now that we're hearing from our organizations that, number one, get us really upstream and get us working where we need to be working. And then what are those initiatives of those 18 that are specific complements to how we'll be successful in supporting our communities during the time of COVID. And so these really were those 4. And so the creation of a system of coordinated care, no wrong door, that is a large priority. That is where we re-envision how we work together as community partners, and really supported by a brand new intimate inventory of working relationships, and then using a technology to be able to provide closed loop referrals to one another. Being able to have better data. I know I'm speaking to the choir here, but specifically in rural areas, we are really strapped when it comes to really good data, specifically community and county level data. And so being able to create a new dashboard that supported the work of all of our partners, and then really providing training on adverse childhood experiences. And so not just at the awareness level, but really around the responsive level, around how we start to braid together those promising and best practice to mitigate adverse childhood experiences, and how we start to have customized training opportunities here in this area. And then the other is really looking at those life skills and soft skills and workforce training. Our workforce is really struggling right now. And so how do we best support them? And how do we think through skill building that will, create different workforce and pipelines here in our area? If you'll go ahead, please. And then how are we going to work together? Those 4 priorities that I showed you that are our common agenda pillars. How are we going to really stand those up and make some really great strides and progress towards those? And so we worked with FSG to help to see, how are we doing as a collaborative? How are we doing with collective impact? And they were able to give us some really great suggestions. And so how we started working together we are so much more mature now. And so what the slide that I'm getting ready to really show is how our current structure is, and how it is reflective around being able to be responsive to our communities and taking their buy into that, and then also the recommendations coming from the consultants. And so here, this is our structure. And so we have two backbone organizations. We have the United Way of Southwest Virginia and then Ballad Health serving in those roles. We have a 26-member unique organizations leadership council that meets very often to really be responsible for one another for all of the priorities and all of the committees that are meeting. We have an executive committee that is able to operate a little bit more nimble when things need to happen from the leadership council. And so they represent, they're a subset of the leadership council. We have a governance committee, a community engagement committee, and then metric and evaluation, who really owns that data and evaluation framework that I was discussing earlier. Then, of course, we have our multi-sector organizational membership. We have over 300 organizational members right now that are part of the Strong Accountable Care community. And then of those, they really align around our work groups. And that's where the work really starts to happen. And so we have our No Wrong Door work group. We have our data dashboard. We have our ACEs and resilience. And then we have our workforce training. And then all of those are really supported by the actions of the work group. So each of our organizations that make up these work groups, that make up our entire membership, they have specific organizational action plans. That is how their organization is carrying out these functions of this work group. So then that way, when you think about what does it look like on the ground of our strategic plan, is that you can go in and you can look at those action plans for each of the organizations. And then that is it for me. So thank you so much. And I think Melissa said we're going to hold off, but I'd be happy to answer any questions of our common agenda strategy and how we got there.
Yeah, great. Thank you so much, Paula, for that really detailed example. Hopefully that helped folks see it come to life. I want to put up here the ACE Nashville theory of change as well. So you have another visual of how hearing from Kylan earlier, but how this all comes together in their theory of change. Kylan, is there just any context you want to add to this? Otherwise, we can leave it up for folks to just take in.
Yeah, I won't try to explain every little part of it. I'll let you take a look at it. However, I did just want to highlight that I mentioned the original 44 Nashville leaders who came together during our consensus workshop. This was really the product of that workshop. So we use a evidence-based facilitation method called TOPS facilitation. And it is, really a way for us to parse out what our collective goals are. And so I mentioned what our work groups are before. Those became our 4 priority areas. And then this is really, our common agenda here is prevent and mitigate the lifelong impact of childhood adversity to improve the safety, health, and prosperity of our community. And we saw this as really a systems level approach and what it would look like to build a diverse coalition of champions for children.
Great, thank you for that. I'm not going to go over this one just in the interest of time, but we'll share the slides. This is another example of a common agenda for a statewide effort in New York on juvenile justice, just so you can kind of see a balance between the community outcomes and the youth outcomes and the types of system strategies that they looked at. So with that, I'd love to just pause and use our last couple minutes for questions. We won't go into breakout groups again because we're just at time here. There is one question for Paula about how you chose the executive committee, if you don't mind speaking about that. And then as others have questions, feel free to share those in the chat.
Yeah, great. Thanks, Melissa. And I was typing, but I realized I'm a very slow chat typer. I didn't realize how slow I was to try to respond to Wally. So the executive committee is really a subset of that leadership council, and it consists of the chair, the vice chair, the backbone organizations, the accountable care community director, and then 2 Virginia Leadership Council members and 2 Tennessee Leadership Council members. And those council members were, those names were put forward and then were voted on by the leadership by the entire Leadership Council to serve in the executive committee role.
Great. That's really helpful. And I've seen a lot of executive committees be formed, and it's pretty typical to what Paula just mentioned. So trying to make sure that there's beyond just some co-chairs, but representation of the various folks who represent different geographies or populations or funders and backbones, the governance kind of model. And it's a way to have, especially for the backbone, to have some go-to folks for that backbone or set of backbone staff. So they're not always having to go to the larger committees. So it's really helpful for governance to say, okay, to spell out for the executive committee, what do they have the power to do or to put recommendations forth to the larger group? Because it's always a balance between, trying to build full consensus of an entire coalition on what are some of the decisions that can be taken in a smaller executive committee, but then kind of approval by the larger group. Other questions? What I'll do is I'll go through the next steps, and if other questions come up, I'll address them at the end. If not, maybe you all can have a couple minutes back in your day to transition to your next likely virtual meeting. Jen, if you just move forward a couple of slides, I believe. Well, I guess for the breakout, just go back to, sorry, Jen, if you can go back 2 slides to the breakout session slide. I'll just give you folks these questions just for your own reflection, taking away from this session. To think about, where are you now in the process of defining the common agenda? Which of these 5 items does your initiative have? Which do you not have? Where do you feel like you've made good progress? Where are you getting challenged? So just to think about that, we may have that be an icebreaker in our next session if you're able to join. But please just think about, what you're taking away from this session in terms of the common agenda, where you're at or where you'd like to make more progress. And then Jen, if you can go forward 2 slides. Yep. So our next session will likely talk more about those structures that Paula just described, as well as the backbone. So please join us. I believe that's on June 1st. And then June 22nd, we'll be talking about equity as an imperative for systems change, and really talking about equity, diversity, inclusion, all those things that are at the bottom of the pyramid, as we discussed today, that influence everything above, and sharing some more examples. And we'll probably have time for other topics if there's things coming up for you. Jen will put a feedback survey link in the chat, as well as follow up via email. So feel free to share any feedback. It was really helpful to hear from folks who shared feedback from the first session about how we could improve things. If you do have any questions, feel free to also reach out to me directly, melissa@oomerconsulting.com. Happy to share additional resources, answer your questions offline. So with that, I will hand it back over to Jen for any closing thoughts and next steps that I forgot about.
No real next steps. You'll be getting an email from me by close of business tomorrow with the link to the recording and with a PDF version of Melissa's slides. I also just want to thank everybody who made time to be here today. I love seeing local examples of where this is effective, because it shows us that this isn't just some other part of the country's thing, right? That this is something that is working here in Tennessee in both rural and urban communities. So take the time to let us know how we did by clicking that link in the chat. And we hope to see you all back here on June 1st. Everybody have a great rest of your day.